Hello, welcome. I'm Paige Pinkerton, Communications Manager for Age of Central Texas. Welcome to the March installment of our Aging Answers video series, where we talk with experts on aging resources. Today, we are talking about the resource availability for older adults living with disabilities. We are here with Siena and Valeria, two experts from Aging Services. I will go ahead and let them introduce themselves and what they do.
I'm Siena Lindemann. I am Assistant Director for Program Implementation, Aging Services at the Capital Area Council of Governments, and it's great to be here with all of you.
And I'm Valeria Rios, and I'm the Aging Program Specialist for the AAA and the ADRC.
Thank you so much. Perfect. We want to go ahead and start out by just defining a key term that will help our audience understand the conversation a little bit. Can you all please define what it means to age with a disability?
Sure. I don't know that there's ever such a thing as an exact definition of that, but a couple thoughts occur to me based on our work together at the Aging and Disability Resource Center and the Area Agency on Aging. We're basically sister agencies under the umbrella of Aging Services. And so we do serve both persons that are, in a sense, older adults as well as people with disabilities of all ages, but we do tend to have a good focus on older adults who, again, for a variety of reasons, may also have certain disabilities. And in that world, as it will, there's a couple thoughts that I have as mentioned. So one is that aging does not mean that you have a disability. Aging itself is not a disability. And we all know, both from the media and probably in our own families and friends, that we know 90-year-olds that are still playing tennis, and we know people who are 60 who, for different reasons, may not be able to play tennis. And there are folks who have lived with certain disabilities, perhaps physical or cognitive, or there's all kinds of range for perhaps their whole life and are very accustomed to it. And then there are certain people who, as we develop or we have an accident or something like that, we develop or we learn to live with a disability later in life. And so all of those things are true. And just like for the younger population, one cannot assume by looking at someone whether they have a particular disability. There are some disabilities that we look at someone and we may say, oh, they are utilizing a wheelchair. But we may not know that that's for 2 days because they broke their ankle. On the other hand, we may look at a person who has no wheelchair and think, oh, that's not a disability, but you do not see that's not a visible disability, and perhaps they've had that particular non-visible disability their entire life. So it's very important to, in that sense, never generalize about people. And each person's a unique individual, and whether they've lived with a disability for a lifetime or just for a few days, there's a lot of supports that are out there for them, but it's all based on who is the person, and we're very oriented toward that. We call that being person-centered when we work with them or talk with them and look at what resources are available for them as well as their friends or family.
Thank you. That's a great definition. Thank you so much.
Sure.
I think that we can go ahead and I believe Siena and Valeria have prepared a presentation on the resources that Area Agency on Aging offers. I can now go ahead and hand it off to them to share their presentation.
Thank you, Paige. So we'll go ahead and start with the Capital Area Council of Governments. And as you can see here, we serve a 10-county region. And the purpose of a COG is really to strengthen the Capital of Texas 10-county region by supporting urban and rural local governments through coordination, collaboration, and the sharing of ideas and resources across the 10-county area. And the Area Agency on Aging and Disability Resource Center, as you can see here, we are listed as one of the 7 divisions that falls under the Capital Area Council of Governments. And as a Area Agency on Aging, our mission is really to provide quality services to support and advocate for the health, safety, and well-being of the older individual in the region. Now moving on to the Aging and Disability Resource Center. As Siena mentioned, this is a sister agency of the Area Agency on Aging, and we really do work in tandem with providing services to older adults. And so the Aging and Disability Resource Center of the capital area is a single access point to services and support program benefits for older adults, those with disabilities, and their caregivers. So with the network of federal, state, and local governments and nonprofit organizations, the Resource Center is able to assist older adults and disabled residents with the single best resource for discovering information about services and benefits that they may need. On this next slide, some of the services that are provided are information and referral. There's also long-term in-home care guidance and access to benefits and navigating those resources. There's also respite care that is short-term. There's Medicare Part D screening and outreach as well. And the local contact agency for non-Medicaid patients seeking to move from nursing homes to community living. On this program, you can see it's the lifespan respite. And so it's really meant to give caregivers a break, and because caring for a loved one can take a lot of time out of someone mentally and physically. The lifespan respite program, it assists with offsetting the cost of receiving respite care for caregivers who meet the program's qualifications that are listed here on the screen. And we also have 3 different types of respite care, as you can see: in-home, center-based, and out-of-home. On to our next program. Through a partnership between the City of Austin and CapCog, operating at the ADRC, has made it possible for the ADRC to help provide income support for Austin utility customers. So this program provides financial aid to customers who are having a temporary problem paying for their utility bills if they meet the program's criteria that's listed here for both the Austin Energy Program criteria and the ADRC Area Agency on Aging Program criteria as well.
And Valeria has talked actually about 2 programs that are very much part of our own program for the 10-county area that we serve around the capital area. And this next slide is actually something that all aging and disability resource centers throughout Texas, and there is an ADRC for each part of Texas, there are 28, that all ADRCs provide, and that is making sure that people are aware of their benefits, particularly related to something called Medicare Extra Help. Many people do struggle paying Medicare premiums. I know my kids think that Medicare is going to be free for me, but actually it is not completely free. But there are some federal programs to provide assistance financially to people who are denied Texas Medicaid, probably because of income, but still struggle with Medicare. And we make a referral to our Medicare benefit counselors, state certified, that are here as part of the Area Agency on Aging. And so we want everyone to know that no matter what their disability, or if they are on Medicare, or what their age is, they can check into Medicare Extra Help, and that also there are preventative health benefits. Some of these are fairly new. They didn't used to be in place a year or 2 ago. So we also like to let people know about that. So we also are a partner with the Texas Technology Access Project. This is a terrific program funded through federal funding. Every state has one, but in Texas, we have it centered at the Center for Disabilities at the University of Texas at Austin. And what this allows persons with disabilities, again, of any age, or their caregivers to do is to check out some of these new technologies. I call them new, some of them have been around for a while, that might keep them safer. So it can range from being able to use a smart speaker in your home to a system that allows stoves to be turned off automatically. And everything we do is around the idea of supporting independence and choice for people to age in place, no matter what their disability or their age. And this is a terrific partnership. We have all these services that they offer to lend the kits and train people on the kits and send the kits back and forth. All of that is free. And we love our partnership with that. We also do, of course, information and referral at the Aging and Disability Resource Center. And anyone who calls us, we provide options counseling and we person center it. But in addition to persons who are older or persons who are disabled or caregivers calling us, and we do get lots of those, we also get a lot of calls from what I like to term helping professionals. And that has nothing to do with whether they have a degree. It just has to do with the fact that they're probably working either for a nonprofit or a government or a hospital or something like that agency. And here are a couple tips we like to mention to helping professionals who are serving consumers related to accessing information and resources from the Aging and Disability Resource Center. Very rarely is it necessary to include any information that is confidential. We really don't need that. And of course, the email is not secure unless you encrypt it. So we just advise that, we often, just based on what people tell us, and the same applies if you're a caregiver and you want to email us about your loved one, we don't need anything related to a number or a date of birth or an address or anything like that. It is nice to know where people live because we do serve a 10-county region and resources vary city by city, county by county. So these are just a couple of the tips that we encourage people when they're accessing us that we want you to know about.
And on this screen here, you can see the direct line for the Aging and Disability Resource Center along with the email. It's adrc@capcog.org. And as Siena mentioned, private or confidential information should be sent secure. And so, as we mentioned, with the Area Agency on Aging and the Aging and Disability Resource Center, they are sister agencies. Specifically for the Area Agency on Aging, some of the core programs, as you can see here, is information and referral, nutrition services, benefit counseling, care coordination, ombudsman, and health and wellness education. And as you can see at the bottom of the screen, appointments are highly encouraged, but majority of our services are provided over the phone. So some of the eligibility requirements for the Area Agency on Aging services are primarily for persons that are age 60 years and older. That is our age requirement. And they are also too, if they're Medicare eligible. In terms of being a caregiver, if you're a person, if you're the caregiver for someone who is 60 years and older, you would qualify. Or if you're the caregiver for an individual of any age that is diagnosed with Alzheimer's or disease-related dementia. Also too, we have here older relatives that are not parents, but are age 55 and older, providing care to children under the age of 18. So we see a lot of grandparents. And the last bullet here is including parents that are age 55 and older that are providing care to adults 18 to 59 with a disability. And so for the information and referral line for the Area Agency on Aging, we do have our intake line here as well and our email listed below.
So I know one of the questions that we were asked to mention about is, what do you think, Valeria, are some of the biggest challenges that older adults with disabilities face in our community?
So yeah, working on the information and referral intake line, a lot of what we've been seeing that our consumer needs is transportation, accessing transportation, also managing the increase in housing costs as well, and limited or non-existent health insurance for adults that are ineligible for Medicare. We've also seen a lack of affordable in-home services and the difficulty of maintaining that independence in the home to be able to continue to age in place.
Absolutely. Thank you so much. That was so helpful. I'm sure our audience will find that very beneficial. We are so grateful to be able to partner with you all and the partnership we have had for so many years. Thank you so much for your time. If it's okay, I have a couple additional questions that I want to follow up with. Um, Another question that we had was, I don't believe we've answered yet. What are caregivers for older adults with disabilities most unprepared for?
So I'm thinking that that is perhaps the availability or the planning for in-home care. And of course, not all persons with disabilities of whatever age need services within the home. But we do talk a lot with caregivers as well as the persons with the disabilities related to services within the home. Now, the great news is that some people, and this is very understandable, I often talk a lot with caregivers and they're like, I didn't know any of this. And I said, that's because we don't learn this in high school. Nobody gives you a caregiving 101. And if you did in high school, you'd probably sleep through it, right? But it is true that there are a lot of resources so that people do not have to move to a skilled nursing facility or something like that. Most people, of course, want to age in place. That's not possible for every single person, but there are services to assist people within their homes, and those can be paid for through Medicaid. Medicaid is not the same as Medicare. Medicare, as we often know or are explaining, is a health insurance program that is primarily for persons that are 65 or above, but it's also for persons with disabilities if they've been granted Social Security disability and 25 months have passed. Medicare is not generally available otherwise. Now, there are many exceptions. We don't make that determination. But Medicare doesn't ever pay for what we call personal attendant, like in-home bathing, dressing, grooming, helping someone to the commode. It also doesn't pay for light housekeeping, keeping your house tidy, helping me make a meal if I've developed a disability where I really can't do that very easily. The great news is that there are some other funding resources. So for example, if for certain veterans and their spouses and their widow or widower, there is what's called aid in attendance that can help pay for it. Or if that's not available, because most of us haven't served in the military, there is Texas Medicaid, but it has to be applied for and it has to be approved. So many people aren't necessarily aware of those costs and how that might work, and not everybody's eligible. So I would say that's one of the challenges that people learn a lot about very quickly, sometimes, unfortunately, like all of us in an emergency situation.
Sure, absolutely. Thank you so much. One other question that we had for you, one out of two. What are the biggest misconceptions about aging and older adults with disabilities?
Anything with it?
I know that we talk about ageism a lot, and the idea that certain diseases are not really associated with the age that you are, and you can continue to be as active as you possibly can and would like to be. Especially in our health and wellness classes, we talk a lot of self-management and being able to feel a little bit more empowered about decisions and things that you are able to take control of. And so, yeah, I would say some of the common misconceptions is that as you get older, you're going to be less active, or as you get older, you're not going to learn or be caught up with new information and things like that. So those are just a few. Are there any?
Oh, I think that's great. And all our, for example, our health and wellness classes, again, help people to remain independent. They're all free, which is terrific. Valeria teaches those. So I would agree with that. Another perhaps misconception is that as caregivers, we can do it all. And one of the reasons that we are able to have a respite program, it is very short term, but caregivers need to take a break when they are supporting someone who has a disability or who is older. And it's okay to do that, as well as, so that's one of the other things I'd mention. Yeah.
Thank you. My last question for you all is, how do you see resources for aging with disabilities changing in the next year or so? And or what is coming up next in this area, if anything?
So one thing that actually isn't new, but I do want to mention is that area agencies on aging are federally funded through the Older Americans Act, and that was instituted in 1965, but it continually evolves, which is great. When it was first implemented, it didn't have supports and funding and assistance for caregivers, and now it does. And in fact, that age was lowered for many programs to 55. So things are always changing. But the great thing about area agencies on aging is they're not limited just to Texas. They're throughout the United States, and everybody has access to them. So whether your parents or your loved one with a disability live here or live in Guam or live in Kansas, it doesn't make a difference. Those core services that Valeria talked about are available. And I think more and more people, as the baby boomer generation does age, are learning about that. So that's a trend we see. Another times we also see people who are like, well, I don't need that, or I'm taking money from other people. Well, the great thing about this agency being, particularly the Area Agency on Aging, federally funded, is, as I say at the senior centers, how many people have here, we've all paid taxes. Well, your taxes went to go assist people when they needed it. Your taxes went to support, when you were 25 and paying lots of taxes, your taxes went to support your grandparents or your great-grandparents and other people's great-grandparents. And now this is not charity coming back to you when you need it, whether it's for an in-home provider through Texas Medicaid or whether a short-term grant for respite for caregivers. This I hope that is a trend that more people will understand, that this is their time to have the support of the other people paying into the system. And one last thing I'll mention, then I want Valeria to give her input, is I'm very excited by the fact I've been lucky enough to be exposed to some of the assisted technologies that are out there, and that's about being independent. I'm perfectly fine to have a fire type thing in my home if it's going to let me stay in my home. I think that is a really cool idea. If I start forgetting to turn off the stove. And again, you don't want to make an assumption just because someone's older does not mean that that person doesn't turn off the stove. I probably don't do that at any age. I wasn't very good at that. I should have got it a long time ago. So I'm excited about the opportunity that we will see over the next couple years for different technologies to allow people to remain in their homes in a safe way, and for caregivers to feel even better about, and I know in my case, again, to stop calling my mother and worry about her. So that's something I'm excited about. And Valeria, anything you want to mention?
Yeah, absolutely. I think just everything that Sienna said, and just increasing the funding for programs and support and resources that are really going to meet the needs for all older adults to continue to age in place.
Absolutely. Great points. Thank you so much. That was wonderful. And thank you so much again. We're so happy to have you here today. And thank you for your wonderful presentation. I know, like I said before, this information will be super beneficial for our audience. And thank you so much again.
It's
Thank you.
truly a privilege to get to partner with both of you, but also with Age of Central Texas. We look on it as an honor and a responsibility, but also an honor, an opportunity, and a privilege to serve the older adults and their caregivers and the helping professionals throughout our community. We get wonderful support, and this is an example of that. So thank you.
Thank you, Valeria and Sienna. Hope you have a great rest of your day.
You too.